at the least provocation and in most cases without provocation. I think that as a ministry, we have a clear mandate to deliver, to improve upon the health sector. And it's expected, especially the players in the sector, for everybody to come on board for us to improve upon the sector. We have Mahama Cares to deliver. And at this point in time, we are ruling out the secretariat. We have free primary health care to deliver, and we are aggressively pursuing it. We have to ensure that claims at National Health Insurance are paid promptly, and all of you attest to the fact that we are doing so. We have our health facilities to retool. Maybe within the week I will be taking delivery of equipment for screening of cervical cancer delivered by Telecell. These are the issues. When we took office, the portal for admission, we have to improve upon it. Today, as I speak to you now, people sit at the comfort of their homes and can apply. These are the things I think that everybody must come on board for us to address. How we can fight outbreaks. We have MPOX at hand at the moment. We have the National Rapid Response Team, we have the Regional Rapid Response Team, the District Rapid Response Team, and very soon we are taking delivery of vaccines to integrate it as part of our response mechanisms. We have huge numbers of health professionals who have completed schools and they are settled at homes. And the government is putting effort in place to be able to make sure that these health workers who are at home get employed. Government is looking at employing some of them. We are looking at how we can export some of them. The measures include how we can look at it from the point of making them attractive on the global market. Specialists coming out with programs, that will make them specialists. And at the moment, as I speak to you now, we are looking at the post-basic specialist program. We've constituted a committee, including the rector of Ghana, Ghana Nurses and Midwives College, and then the registrar for NMC, right? For all of us to come together, let us come together and find solutions to the problems that exist. That is our preoccupation. Ladies and gentlemen, at this point, let me use this opportunity to state the chronological event that happened after the incident that occurred at Ridge Hospital. On Monday morning, I sent a delegation to Ridge Hospital to ascertain the situation. When the delegation came up, upon debriefing, I realized that I had to follow up. And ladies and gentlemen, let me state this, that I have the health workers of this country at heart. And so any attempt by any individual or any group of people to try to incite the health professionals against government, pretending he cares more than us, is unfortunate. And we must stop that. It's an avoidable tension we must avoid. It doesn't help the sector. If indeed you are a practicing health professional in the sector, it doesn't help the sector. And so, when the delegation came back, I had to follow up. I was in the company with the Deputy Director General and other directors of the ministry. We joined the medical superintendent at the Rich Hospital, and I visited the victims. After going around, we had a closed-door meeting to discuss the issues, not insults. One, how to look at beefing on the internal security, staffing issues. So after the closed-door meeting, I came out to address the press to categorically condemn the physical attack. And that is the most important aspect. And for me, let me at this point reiterate to the whole country that irrespective of the level of provocation at any health facility in this country, nobody, irrespective of your status in society, absolutely nobody has the right to attack any health professional in this country. That is the gravamen of the issue. No diversionary tactics about handshaking. That is what we must concentrate on, to send a clear signal that our health professionals working at the various health facilities are safe. And so after the engagement with the management, when I pulled out of the ward, then in fact, in the engagement with the management, I made it clear to them that I had listened to their side of the story. And therefore, as a minister, I will also listen to the other side of the story. And I then constituted a committee to look into the matter, bring out recommendations for implementation. A lawyer, a nurse, a medical doctor, an auditor, an HR person to go into the matter. Now, when I pulled out, my attention was drawn to a gentleman called Ralph, who was at the center of the controversy. And so he was working towards us as a group. The medical director was with me. The deputy director general was also with me. Then I asked, why did you do this, gentleman? When I asked, most of you were there. I mean, the press, you were there. So you can attest to what I'm saying. You were there with me. When I asked him, the gentleman then stretched his hand, shaking me, and trying to whisper something into my ears. Ladies and gentlemen, at this point, should I push the guy that don't whisper anything into my ears? Should I snub him? Should I shout at him? Even if that guy has been prosecuted and sentenced to life imprisonment, and he stretches his hand to shake me, as a minister, as a public officer, I have the duty to stretch and greet him. So let us not reduce the fact that I shook hands with him does not mean that I should stop any measure or any steps that the ministry or government will take to unravel the situation. And so I understand, on a more lighter note, I have been reminded of the fact that I'm a farmer. Yes, nobody needs to remind me. I'm a proud farmer, and everybody knows it. Not until my appointment, I was one of the largest rice farmers in this country, and I'm proud of that. Please, we have a lot to deliver, and some of these things will not divert our attention. We will continue to do our best for Mother Ghana. I thank you for the opportunity. So if you have any question.
So if you have any question, we'll take them in batches. We'll take them first five. Please raise up your hand, identify yourself, and then the media houses you are coming from. Before we do that, Minister, I want to just go back to Amchi, just do it briefly in Chi for us, then we can take the questions. Thank you.
Yo, Madam Asibibre, dear Mikaye Yana say, Yanyanti, na ya train ya dream so esiso. Ewe a kwan bia union leaders a binom edidi matem no mo sopame abra me nyo mo hwe me de madwen ni se amamuo ananyansa de ini nipa ba ko fotiri nti obia oye adwuma e wo health sector na wo so de na adwen ba ni ehwe kwan ya ye be fa so a health sector no ebetumpon anya atem didie ye wo case ye hu adwuma samre ye duru akiri pa ye free primary health care ye hu adwuma e kwan be ne ye be fa so a hospital ahodo ebenya mfidi omode be ye adwuma ya nurse for any health professionals ahodo mo be school omutifie omunya adwuma nye ene de keka ka ho bebre e wo se tu ho anamo anya atem didie ni ye de be ye adwuma wa ha eno so mu ya bam emfri de wo se ye ho ma de ewo mu ni say weekend atwamu yi assemby esi our Rich Hospital esi ye no manti anda mesoma directors binum say omonko Rich Hospital ho omonko hwehwemu omoba wa mane omoba ye na meti omu nsem wie ye no na hu akohia say e wo say me ankasa mitu anamo na mekọ ho enkanka sane yese yabo obi na ayese a doctor for any omo ye adwuma wo ho no omo wo ehun bi ato omo so omo ntumi nya adwuma na wo say me ankasa as a minister no mekọ na mekọ reassure wo no mekọ na mekọ hye omo nkuran nti mekọ ho mekọ ye no mekọ hwe ayarefo a omo ho miwie ye no mini management edi nkita ho ya ma pressman bia anma ho ye nkita ho die na kire no ye hwe nioma ye be ya ebetumi improve hospital no ne dwumadie ebi ti say kwan ye be fa so a ye security nsam be koyie wo hospital ho ebi ti say kwan ye be fa so a ombenya adwumayefo dodo yedi nkomo ni nyina wie ye no na asema me kan nyina mo nhyɛ ne nso sɛ anya asam no mu na me kyerɛkyerɛ no de ɛwɔ committee nsam ni sɛ obi yɛ bɔne sɛ obi anya bɔne time ben obi kɔ hɔ hwan na ɛbɔ obi hwan na ama obi anya na me ka ho asɛm if you say mon kai sɛ asam no ne nan ne yɛ mienu ɛwɔ de yen as ministry betimi adi ho asem and ye what the criminal aspect meti hai the criminal aspect is not within my jurisdiction. The police will deal with that and they are dealing with that according to my information. Inti mi wie we nyina no a me pie ye no me pie abonten no na obi omo draw my attention catch him say friend Raf na mo nsantrefo bebre mu ho minim no me ka say Raf na ye kan asem na ye den na sa asem we see ye na Raf no mi bisa ne sa na o ten ne nsa sa obechiam no aka bibia gumasum adofo mintimi mpushi nipa yi mintimi mmono na in fact the kanku masumu ni say minister member office ma be chechire o menso medim ta no ka kire me and asem si so a aso tie afanu ni nyina inti boni amaye ni say Ghana ni stretching in say, or person cheer me, na me so much cheer ni. Na some man cheer no so and can them what they work differently. The conversation would have been different today. If I had refused to greet him, I'm very sure that the conversation would have been different today. Intimate cheer ni bi. And no interest say they was ye biano, ya cheer ni nti. Ye ntumi nyesa nema. Nti ye besrem. There was a bia who will do it. At the end, the criminal aspect and the ministry no so and I'm more you too. Now, so someone become a catch war and they say, Matis will be kind, me say, Massa, we are queer new. And they make any and they say, in years of you kind, meaning that be a democratic. Some you queer, we are queer, Cassia, Namini Pokwa, so, Madame Massey. Okay, that one can come later. So, yeah.
Okay, so listen.
Is it okay?
Yeah. Thank you very much. Let me say that the Honorable Minister is ably supported by his agencies. This tells you the leadership is provided for the health sector. We have the Deputy Minister for Health. We have the Chief Director. We have other agency heads from Nursing and Midwifery Council. We have the MOFA. We have Ghana Health Service. Other agencies who are currently represented here, just to let you know that they are fully backing the Honorable Minister and they will go all lengths to support the Minister because of the good work he is doing in the health sector. We have a call center or a number we will show you so that you can help the public reach out anytime they have complaints, anytime they go to the hospital. We are adding this. This is not one of our mandates. It's supposed to be the agencies, Ghana Health Service, CHARC, teaching hospitals. But the Minister for Health thought that this will go a long way to enhance service delivery. Thank you very much. So we'll go straight to the questions. We'll take 5. Let's take the lady first before the young man. Please identify the media house you're coming from. Do we have an additional microphone?
The police for detaining him on his return, arguing that they should have instead focused on those who were with Mohbad in the 24 to 48 hours leading up to his death. Marley emphasized that they had no reason to arrest me, pointing out that he even had his passport seized for 2 months during the investigation. He returned to support the probe and clear his name.
They're going to arrest everybody that was in the house with him. In the last 24 hours, 48 hours. They have no reason to arrest me, mate.
We are grateful that you stayed with us here on Channel 1 TV. We would have to move back again to the Health Ministry and bring you what the Health Minister is saying to the press.
Express anger. Sometimes they do not even give you a listening ear. So how do we salvage the situation such that I don't feel that way and then sometimes endangering the lives of health workers?
Thank you very much. We'll take the next one. Please, let's go straight to the point because of the interest we have or this story has generated. Let's go straight to the point.
My name is Josh Queen, I work at TV3. So I have to take Rafael to revisit the issue of medical negligence. And there's one, maybe 2 cases that have actually caused the nation a lot. So before this, what was the ministry doing to tackle medical negligence? Because I think it's an issue of great concern. And so the others that are saying that the next in question should test the law, because obviously I know the leadership of the Ghana Registered Nurses and Midwives Association says to advise themselves if their grievances are not met. So she has to go to court, file the complaints, and not the leadership, find the complaints on her behalf. So I think while she's also testing the law, what do you think is the appropriate channel where our rapid actually use this platform?
Thank you very much. We'll go to GBC. Sarah.
My name is Sarah Furi from Ghana Television. Honorable Minister, I would want to ask you a few questions if it has come to your attention. That it seems this gentleman in question had in the past made some utterances about preventing someone from getting an emergency care during some protests that happened in the past. For which reason, others are seeing it as a tit-for-tat event. I was told that there was someone bringing his child to 37 military hospital during a protest, and he stopped them, and the person's child died. So in this case, it's like karma coming back to him. So if the nurses refuse to attend to his relative or whoever, it serves him right. If it has come to your attention, have you also found out forensically whether the nurse in question has the arm or whatever dislocated? Because we need to prove that, so that it doesn't seem like we are all being used to push an agenda. My second question is that, has it come to your attention that our emergency response system is really poor, for which reason we saw what we saw at the Ridge Hospital, and what you would do about that?
Thank you. Okay, Minister will respond to the three, and then we'll pick another batch.
It looks like the three is very loaded. Okay, so if I remember, the first question was when the committee will conclude its work. We are giving them 1 week within which to present to me their report. So that's about that. And what will we do, or what are we doing about the fact that people have to fight for attention when they get to the various health facilities? And let me make the point again. Here, you don't need to literally fight. You have no right. It is not like I'm appealing to you, or it's like you are being persuaded not to fight. Or no, you don't have that right. It's illegal. It's unlawful to attack a health professional. And so the best you can do is to lodge a complaint. And that brings me to the client service. So this is what we are doing. We have some numbers available where if people feel dissatisfied, okay, I'm told the numbers have been displayed on the screen. When they feel dissatisfied, you can then call. The fact that you have called to lodge a complaint doesn't mean that you are right. We will look into the matter and then appropriately dealt with it. We have communicated directly to all the health facilities in the country through the Director General and the teaching hospitals that they must make these suggestion boxes and numbers conspicuously written or posted on all health facilities. So it is something I am pursuing aggressively. But that does not mean that anybody should or has the right to attack any health professional because the person feels he has not been given the attention. So the answer doesn't lie in assault. Medical negligence. Anytime I hear that, I clinch. We spend not less than, even in some cases, one facility, not less than 10 million Ghana cedis on medical negligence. Maybe you don't know. As a country, we don't have the money to buy the equipment, but we are spending so much. As I speak to you now, the cases on my table within this week are 3 that Attorney General has written to me to provide responses. Medical negligence. So it's a major issue that we are dealing with. So there are things we are discussing. I cannot put everything in the public domain at the moment. And at the appropriate time, we may address you on medical negligence. It's a monster rearing its head that we must deal with appropriately, and we shall deal with that. Somebody made mention of the fact that the gentleman in question has done something in the past, and so this why it serves him right. I am not ready to go into the merit and the demerit of the matter. There's a committee in place to look at that issue, so I don't want to go into the matter. I have called you here just to state the facts and what we have done, what we did, because I realized that a lot of people didn't understand the issues. In fact, people even thought that I was at the premises when the incident happened, and immediately after the incident, I went and shook hands with the gentleman. Hey, gentleman, you have done well for beating the nest. Can you imagine? Can you? If I think that way, the president, His Excellency John Dramani Mahama wouldn't have made me the minister for this sector. That would have been insane, right? I mean, with the greatest of respect, I didn't do that, and I will not do that. I have my health workers at heart. But the point must be made. I am a minister for the health workers, and I'm a minister for the good people of this country. Whether or not to go and check where the nurse's arm has been dislocated or dysfunctional or whatever you call it, please, that one is part of the investigation, and we'll leave it at that. Emergency system, yes, we have emergency systems in place, but we can only improve upon our emergency system, and it's part of the ongoing, retooling and some of the things we are doing to improve upon the health sector. And so we'll continue to do that. There is a lot, in fact, in the health sector, we have a lot to do. There's a lot, but I can assure you, I'm enjoying those challenges. And so together we'll work. So if anybody has good ideas, it doesn't mean because I'm the minister, I have all the wisdom and all the ideas in my head. Sometimes I see people's ideas and see if it is good for the country, we implement them. And so that is what I can say. As for your rice, one is 350 Ghana cedis.
Thank you very much, Honorable Minister. Let's take last three. I think the Minister has dealt with the issues. Let's take last three, and then we can say goodbye.
My name is Majid Diallo. I report for the Ghana News Online. Minister. I would like to know, when you met the gentleman, you said something to your ears. Can you share with us so that you can help us with our reporters? Hello. My name is Frank from P7. So, Minister, I want to know the security measures the ministry is putting in place in various hospitals to make sure that this incident won't happen again.
Thank you very much. Can we take the last one? Very soon, whatever we are telling our girlfriends in the house, we have to come and tell this gentleman. Let's take the last one, and then we can end. I think we are fine. Honorable Minister.
You are fine, eh?
Yes, please.
Good. Hey, Mwampa. Anyway, so I thank you for the opportunity. What I said into the ears of what the gentleman said into my ears, I said it in Tree, but I think I'll repeat it in English. What he told me was that, Mr. Minister, I'll come to the office and tell you my side of the story. And indeed, he came to the office. Those who work here will maybe, and in fact, let me tell you the coincidence. The reason why people think, and I have heard this one too, that it was managed, it was staged. How did the guy meet the minister at the same time at the place? What really happened, I didn't know. It was after the incident that I heard that the gentleman came to the ministry looking for me at that time. And they told him I had gone to the hospital. And so he followed up to the hospital. So that's the coincidence, that's what really happened. The various health facilities, the security measures we are putting in place. You see, when issues of this nature come, it defines policy directions. And so we already, at every health facility, we have some sort of security arrangement everywhere, the district hospitals, the regional hospitals. But this has given a cause for reviewing the various securities at the various health facilities. And so the Director General with my able CEOs will look at reviewing and then establish that connection between our health facilities and the police in the various districts or at the various destinations in the country, so that at any given point in time. My last words. One, I've made this point more than 5 times in my submission. One, nobody has the right to attack any health professional. Let's show sympathy towards them. Let's understand them. They work under some in some cases, obscure conditions. And they are also human beings. So please, let us not make it normal, that it is normal to attack a health professional once he or she is not giving you the right attention. That's my first one. The last, let me humbly also appeal to the health professionals that the patients, the ordinary Ghanaian, they are our clients. So let's try to communicate with them at any given time, whatever is going on when they come to the health facilities. Let's communicate. They don't understand the work we do as health professionals. But I believe that when we begin to communicate with them, they will understand and appreciate what we go through. I thank you very much.
You have a question? Last one. My thoughts.
So, sorry. My name is Isaac. In relation to what the health minister said, he said there's a board investigation the issue. But yesterday we've seen a CCTV footage online circulating. How come that footage is circulating online? Thank you.
So this one, the Honorable Minister won't answer. Just to say that the committee is also going to review all these footages. So don't worry, it's part of the committee's work. Thank you very much. On behalf of the Honorable Minister, I want to say very thanks to all of you for coming. Please, let's share this message. Let's state the points clearly out there. Let the people know what the measures the Minister has taken and his leadership in this matter.
The director for the sector or the Ridge Hospital is also here with us. I just want you to know that he's here with us and I'm in constant touch with him. He gives me a minimum of 2 times. Yesterday, how many times did you do? 4 times. So yesterday, for example, we spoke 4 times trying to review and getting directions, and then the deputy director is also in touch with them, just for you to know.
We want to say very big thanks to the Honorable Minister, Honorable Deputy Minister, Dr. Grace Ayesudankwa, the various directors from the ministry, the Chief Director, Mr. Desmond Boateng. We have, there's the Military Council Registrar behind, we have MUFA, CEO behind. We have a lot of CEOs who are currently here supporting the minister. We want to say very big thanks to all of you for coming. May God bless us all.
So you heard that from the Health Minister, Mintah Akandoh, stating it clear what happened at the Ridge Hospital. Also, he indicated what Raf told him when he exchanged pleasantries with him, what he said into his ears, and other things. We're bringing you more of this on our subsequent bulletins on Channel One TV. Well, this is how we end today's edition of Breakfast Daily here on Channel One TV. I am Philip Nilati. But before that, what we want you to note is that what happened at the Ridge Hospital has been cleared by the health minister. He stated that, well, Raf told him that he would come to the office to see him. But we'll be bringing you proceedings from the Public Accounts Committee shortly. Don't go anywhere. Stay with us here on Channel One TV. I am Philip Nilati. I did the show with Chris Carter, and earlier, Nana Tufo Boateng was here. Keep watching Channel One TV.